Hello, my name is Alexandra Kiefer. I am a nursing student in Nurse 505 Advanced Health Assessment at Liberty University. I am doing my proctored head-to-toe assessment, and I'd like to introduce my proctor now.
Hello, my name is Amina Tharp. I'm an adult gerontology clinical nurse specialist, and I'll be proctoring Alex K. Kiefer today.
Our patient today will be Grant. Grant, do you consent to this head-to-toe assessment?
Yes.
Okay, great. For time purposes, we've already grabbed a set of vitals. My hands are washed, and I'm going to go ahead and get started. First, I'm going to take a look at the upper extremities, take a look at the skin. Everything appears to be normal color. I don't see any lesions, bruises, scars at all. I'm going to go ahead and feel now. Everything feels warm to touch, nice and smooth. Turgor is good, nice and hydrated. I'm just going to go ahead and make sure I inspect all of your skin here. Still not noticing any scars or lesions, no striae. Okay, great. I'm going to go ahead and move down to the lower extremities now. I'm going to go ahead and feel again. Everything feels warm. Everything appears to be normal color, normal for race. Hair growth is noticed, which is normal. Feeling for edema. No edema present. No varicose veins noticed at all on either leg. Textures smooth but with hair. And now I will move on to your nails. If you could hold your hands out for me. Checking for cap refill, which is good, less than 3 seconds. The nail beds are healthy and pink. It does look like there may be some dry, cracked skin around the nails, but the nails themselves are firm and thick. No clubbing is noticed on the fingers as either. Moving on to the head now. Looking at the head, appears to be symmetrical in midline with the body, normal size for body. I'm going to go ahead and feel your scalp. Everything feels normal, feeling for bumps, lumps. Hair is thin towards the top, but nice and soft. I'm going to go ahead and feel your sinuses. If you feel any pressure or discomfort, let me know. Okay, great. Now I will go ahead and feel, go ahead and open your jaw, testing for TMJ here. Close your jaw. Good, no clicks observed or felt. Go ahead and move your jaw forward for me, clenched. Move it back. Give me a big smile, a frown. Purse your lips for me. Blow your cheeks. Raise your eyebrows. Close your eyes. Don't let me open them. Great. Now we can move on to your eyes. For the sake of time, we will not be doing a Snellen or a Rosenbach test, but the Snellen test is a test where you would stand 20 feet from the eye chart with the big E on it, and you would read for me the lowest line possible that you can see. This will tell us what your vision is with 20/20 being normal. Do you wear lenses? No contacts or glasses?
Nope.
The Rosenbaum test would be a test where you have a piece of paper with letters on it, and you would hold a comfortable distance for you to read, and then you would read the letters on that piece of paper as well. These tests will tell us if you're near farsightedness with, again, 20/20 being normal vision. We're going to move on to the peripheral eye test. I'm going to hold this piece of paper up to your eye, and then I'm going to bring my fingers into your line of sight. If you could just say now when you see my fingers.
Now. Now. Now.
Great.
Now. Now. Now.
Moving on to the other eye. Same thing.
Now. 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 Now.
Normal. So with your eye covered, you should see the uncovered side earlier, but on the side that is covered, you should not see until midline, which is what we found normal results. Now I'm going to go ahead and do the 6 cardinal gazes. If you could go ahead and take a look at my finger. Follow my finger. Do not move your head though. Just move your eyes. Looking for strabismus, nystagmus, Not noticing either, finding all normal responses. Follow my finger towards your nose. Keep your eyes open so I can see. Follow my finger to your nose. Great, thank you. Now I will go ahead and do the cover uncover test. Where I'm going to have this here. If you could just take a look at my finger on this side. Alright, no strabismus or onychitis noted. Again on this side, take a look. Okay, great. I'm going to go ahead and inspect your eyes. Eyebrows look nice and healthy. Eyelashes are there. I'm going to go ahead and take a look. Conjunctiva looks healthy. Feeling for the lacrimal duct. Does any of this hurt at all?
Nope.
Okay, looking at the color, open your eyes for me. It's going to be a light in your eye. Pupils are round and reactive to light, equal on both sides. I'm going to go ahead and use the ophthalmoscope now. If you could please dim the lights for me. Okay. So we're looking for your lens here, corneal reflex, or red reflex. See the lens, red reflex, retina background, no retina hemorrhages. Everything is equal on both sides with healthy color, round. We could have the lights back on, please. Now that the eyes are done, we can move on to the ears. I'm going to go ahead and put a clean cap on my otoscope. I'm inspecting the outside of the ear, looking at the mastoid, the meatus. I'm going to go ahead and take a look at the ear canal, the tympanic membrane. Looking at the ovum, the malleus, the pars tens, the pars flaccida, normal color. And we dropped our cap, grab a new one. Okay, everything is normal, matches both sides. Now I'm going to do a whisper test. I'm going to whisper a number on each side. If you could repeat that number for me.
99. 23.
Okay, great. I'm going to do the Weber and Rhines test. First, I will be placing my tuning fork in the center of your head. If you could tell me if you hear it more on the right, the left, or if it's centered throughout.
It's centered.
Now I will be placing the tuning fork on your mastoid bone and air. We're testing hearing through bone and air. Once you stop hearing the sound when my tuning fork is placed in this location, go ahead and raise your hand, and I will move the tuning fork in front of your ear. Once you stop hearing that sound, raise your hand. Great. Now I'm going to do the other side of the ear for the Rhines test. Same thing, just raise your hand when you stop hearing the sound. Great, so normal findings here, you can hear sound longer through air than you can through bone. I'm going to go ahead and take a look at your nose now. Grabbing a clean cap for my scope here. Okay. Nose is symmetrical on the face. Go ahead and Plug one side and breathe through. Other side. Great. Go ahead and look up for me. Noticing the turbines, nose is patent. Septum is symmetrical. I'm gonna do a smell test now. Do you smell that?
Yes.
Okay. Now I will go ahead and take a look at your mouth. Open up your mouth and stick your tongue out for me. Say ah. Great. I'm gonna do a gag reflex. Okay. Sorry about that. Go ahead and first noticing that the lips are pink and moist and hydrated. They're not chapped. I'm gonna go ahead, open your mouth and lift your tongue up for me, please. Looking at checking for tongue tie, and then notice looking at the ducts in here. Everything looks good. Go ahead and move your tongue up and down, side to side. Okay. Now we're going to do the assess your neck. I'm feeling the spinal process back here, being symmetrical. Look down. Okay, go ahead and look back up. Feeling for your lymph nodes in here. Feeling for the trachea, which is midline. Go ahead and swallow. Feeling the thyroid gland here. And the carotid. I'm going to go ahead and auscultate the carotid. All normal findings. Okay, now that that is done, we can move on to your lung assessment. Go ahead and say 99 for me.
99. 99. 99.
Okay, I'm going to move to the back side. Take a deep breath in for me. All right, I'm noticing equal rise and fall of my hands as you inhale and exhale. Great. Say 99.
99. 99. 99.
Go ahead and give yourself a big hug. Inhale. Hold. Exhale. And breathe normally for a second. Go ahead and inhale. Now exhale and hold. Okay. I'm going to listen to the lung fields on your back. You can relax your arms now. Every time I move my stethoscope, if you could take a deep breath in and out for me, please. Alright, all posterior lung fields are clear. Moving to the front. Let me take a deep breath in and out. Noticing equal rise and fall of my hands again. I'll be listening. Take a deep breath in and out. Also noticed when I looked at the chest, I did not see any lesions or anything like that. Skin looks good. Go ahead and lay down, and I'll do a cardiovascular assessment on you real quick. Okay. Looking at seeing any heaves, lifts, or thrusts, I'm going to go ahead and feel for a PMI. Everything looks and feels normal. I'm going to go ahead and listen now. listening at the aortic area, aorta area, pulmonic area, Erb's point, tricuspid area, and then the mitral area. S1 and S2 is noted, regular heart rate, and no murmurs or anything like that. I'm going to feel for some 4 pulses. Pulses here. All +3 regular pulses. Feeling still. Relax. Fetal. And QT pulses. All +3 regular. And now I will move on to the abdomen assessment. I'm looking at seeing any drains at all, no scars and lesions. Striae, the belly button is symmetrical with the body. Going to go ahead and listen now. Listening for active vowel sounds in all 4 quadrants. I'm hearing sounds. If I wasn't, I would listen up to 5 minutes in each quadrant. Now I have my ears on. I'll listen for renal arteries. Feeling for the iliac. Listening for the iliac. Now I will go ahead and percuss. I'm feeling for dullness over the liver, measuring and making sure that it's not enlarged, and over the spleen as well. Now I will go ahead and palpate your stomach. If at any time you feel tenderness or discomfort, just let me know. Feeling the liver, spleen. Now I'm going to feel for your kidneys. Okay, great. Now that that is done, we can go ahead and move on to our musculoskeletal assessment. You can sit up for me. Oh, now that I have you laying here, go ahead and lift your hips up for me. Your hands down. Great. I'll have you bring your knee to chest. Checking for range of motion in your knees and your hips. Looks good. Now I'll have you lift this leg up. Try and keep it lifted. Don't go against my pressure here. Try and push it down against my pressure. We'll do the same thing on this leg. Great. Checking for range of motion on your ankles. If you could go ahead and rotate your ankles in a circle for me. Wiggle your toes. Push your toes up to your chest against my force here. Down to the ground like a gas pedal against my force. Great. And then wiggle it, yeah. Out and in. Great. Strength is good. Range of motion is good. I'll have you go ahead and sit up now. I'm going to have you push your head towards against my hand, back against my hand, to the side against my hand, the other side. Go ahead and rotate your head in a circle. Great. I'm going to have you shrug your shoulders up against my force. Great. Take your arms, put them out, flip them up, bend them in. Just checking range of motion here. I'll have you bring this arm to the back of your shoulder blade. Great. I'm not feeling any cracks in the joints by doing that. Go ahead and move it back. Looks good. I'll have you go ahead and flex your bicep for me. Now, try to push your arm down to the ground. I'm sorry, your hand down to the ground like this. Checking your elbow strength. Great. Now try and pull it towards you. Nice and strong. Do the other arm. Now the other way. Great. Hold your hands out like this for me. Try to keep them up against my pressure. Now I'll try to push them down against my pressure. Great. Go ahead and hold your hands like this for me. Try to keep your fingers together. Don't let me pull them apart. Wonderful. Now spread your fingers. Don't let me push them together. Beautiful. Go ahead and take your hands and rapidly move them back and forth. Take your thumb and fingers and connect them, just like so. Great. Now take your fingers, bring them to your nose, each side. Keeping your head straight. Go ahead and do that again. There you go. Now let your feet dangle. Try to push your knees in. Great. Now push them out. Great. I will have you go ahead and stand up now. I'll have you kick your legs back and forth like so, just making sure the range of motion on your hips is good. Go ahead and stand this way so it's easier. There you go. Now we'll do the other leg. Looks good. I'll have you bend over and kind of towards your toes. I'm checking for scoliosis here. Looking at the spine, looking nice and symmetrical and even in line. You can go ahead and stand up now. I'll have you walk heel to toe a few steps for me. I'll have you turn around and walk normal steps back, just assessing your gait, everything looks balanced. Alright, you can come back over here for me. Stand straight and close your eyes. Assessing for balance here. A little bit of swaying is normal, but not too much. Looks good. You may go ahead and have a seat now. The next thing I'm going to do is put something in your hand. If you can close your eyes, open your hand palm up for me. Go ahead and close your hand and tell me what that is.
Feels like a rubber band.
Okay, great. That's correct. Go ahead and open your hand again with your eyes closed. I'm going to write a number in your hand, and if you can tell me what the number is.
8.
Great. Next, I will be doing a sensation test. Keep your eyes closed. Tell me if you feel a soft or sharp edge.
Soft. Soft. Sharp. Sharp. Soft. Sharp. 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 Sharp.
It's 4 o'clock.
Soft. Soft.
Great. Those are all correct. That was testing sensation throughout your body. I'm going to have you close your eyes. I'm going to point to an area on your body, and I'll have you take your right finger and point to the area that I touched. And this is checking for position, okay? Or, I'm sorry, this one. Now use your left finger for this one. Great. That was nice. Good job. Now I will be doing a reflex test on you. Go ahead and relax your arm completely. Keep your arm relaxed. Same thing on this arm. Relax your arm completely. Open your arm up. Relax your arm completely. Relax your wrist completely. Do puppeteer reflexes. Let your feet dangle. Do a ankle jerk. All reflexes present. And I believe this concludes our head to toe assessment.